without doing or performing duties. What are those? There are certain duties what we have to do. As a doctor, we are supposed to do certain duties towards the patient, towards a professional colleague, and towards the state. So, doing these three duties, at least we can still come back to call ourselves as Vaidyu Narayana Hari. Professional colleague does not necessarily mean that we have to deal with only with the professional colleague like a doctor. It can be a paramedical staff, maybe a lawyer. So how exactly we are supposed to behave or do duties towards these individuals is a must. That's what in the morning session also, the chief guest was very apt in saying that the communication, maybe from all these areas, we have to improve. So these are the duties which we have to do. Now, we are all doctors, so what we are supposed to do the patient, I need not list out, because a person who has graduated from a medical college by passing through the internship program, he will definitely know what best he can do to the patient. So I've just highlighted those things which are in red. Just go through those. These are the must areas, or these are the areas, or these are the duties which they have to do. So rest of the things I know all doctors will be doing that. Yes. Now I bring out certain terminology, make you more confused. Are you confused? No, you all know that. It's a very simple term, which is a Latin term. But what does it say? The meaning behind it is very nice. A person who says that, or who says that, let me, a person, or in fact I would put it like this, a person who agrees to get harmed later cannot complain that why I was harmed. Did you understand that? First I agree to get harmed. Now don't ask me when a person will like to get harmed. Maybe during surgery. Okay? So when a person agrees to get harmed himself, later he cannot complain saying that why I was harmed. So with that concept, the concept or the particular idea came about the permission. There is something about permission. What are the legal provisions of permissions, or later I will bring the exact term what permission I am referring to. What are the legal provisions we have? Now I am not full. Okay? As a doctor, we should be aware about this terminology called as assault and a battery. If we do not take a consent trial. Now comes another important term called scope of a consent. This is a bit new, maybe we all knew about this consent, but there is a scope for a consent. What do I mean by scope of a consent? Now to do this, I will give you a very classical case. It's a very famous case. All the lawyer friends will be definitely knowing that. It is a case which happened in Mumbai. A very interesting case. By telling this example, I feel that most of the things will be known to you. So I'll start by saying that it was an unmarried female around 44 years who visited a doctor, a gynecologist basically, a doctor gynecologist, for a complaint of prolonged menstrual pain for about 9 days. Now don't go with the actual terminology. It is for a general person also, you can understand this particular case. So an unmarried woman went to a gynecologist for this complaint. The doctor was very busy, so the doctor said that I have to do certain procedure for that to know that you are complaint. So come next day, you come with your whoever along with her. So next day she does this particular procedure called diagnostic and operative laparoscopy. So she does this procedure. But at that time there was I think so the patient's mother was also there when this procedure was done. Now what happens next? Now during that procedure, the doctor finds one particular that the patient is complaining of all these complaints because of this particular disease. Now I am not going to discuss about what is endometriosis, grade 4, that is immaterial. But she has some disease which is a little serious and which has affected, and in fact the doctor finds that this disease has infected such a level that it has affected the other parts of the organ, not only the concerned uterus, the other parts, that is a fallopian tubes, all those things. Now what does the doctor has already opened the laparoscopy, is done. So she says that, okay, I have already in the operation, so let me ask the consent from somebody. So she says that, or she sends her assistant outside. Mother is sitting outside the ICU or the OT. So she takes a consent from mother saying that your daughter is having this one, so better that we have to go ahead with the surgery, and they do a wonderful surgery which is in the interest of the patient, called as an abdomination, whatever. This particular surgery is done. But the interest was in the interest of the patient. She does this operation. Now what happens next? Operation is successful, the patients come out of the anesthesia, post-op she was very good, she was there, but on the 4th day after the discharge, the respiratory, that's why he died. The reason would have been because of that medical emergency. So what you are supposed to do is that you have to write down, after due explanation, voluntariness, all those, he was not ready to be operated by me, that is why the patient is moving out of this particular informed. That's called as an informed refusal. This is for in safety to the patient, doctor. So defenses again. Now in consent, what is a hospital scope? The management experts are there, so definitely, is there a hospital role? Consent is taken between the doctor and the patient. What is it for hospital? Does it amount to any hospital accountability if the consent is not taken? Yes. Remember that the liability is also there, because it is the duty of the vicarious liability of the hospital also. You know, as Sir rightly said that the individual should be also targeted, or the individual doctor, but at the same time the hospital authority should keep sure that the consent forms are ready, the atmosphere or the particular area should be there where the patient doctor has to communicate. All these provisions are, so hospital role is also there in case of consent. Ability to consent. What do I mean by ability to give consent? Understand. I just mentioned about that. You should be able to understand what the doctor is telling. If he is not able to understand, there is no. If I use what we call as paternalism, or in fact, I bring out a lot of terminologies because I know the medicine. Instead of telling about something hemorrhagic disorder, poor patient, what happened? I have some grave. So then ultimately the patient is unaware about a simple. There's nothing but a bleeding disorder. Simply I could have said that the blood is, I cannot control the blood disorder. Simply. So instead of that bringing of jargons, or it will not exceptions to a material disclosure. Now this is what a doctor has. A doctor has a privilege. Okay? Exceptions. Now imagine a patient who is having a heart disease comes to, and he has to be operated for particular reason. He is having a very weak heart, and as a part of a procedure, he is medically fit to undergo that particular surgery, but he is a cardiac patient, but has a procedure. Routinely, I have to see a certain thing. There are a chance of death in this. Okay, you will maybe around 30% you might die. Moreover, he is a heart patient. Yeah, before going to a surgery itself, he was given medical fit, and then he was sent to OT to do that operation. So all those medication was done, and he was okay. But when you start telling that before taking a consent, what amount of disclosure I am supposed to say? Will it actually needed, or these things actually is supposed to be? We didn't know. Some of the issues you can, as a doctor, you know in each and every case, if you go by with the books, whatever books you go, there are 0.1111% that will be the ultimate is death. So start discussing everything that first to a patient. The patient will first say that I don't want to do any operation in my life. So that cannot be. So exceptions to which the expert board will also consider that. So whenever a case of a negligence is put or a so-called medical negligence, the experts are going to be asked for that. So all these things are going to be questioned. Why these things have been not told? So therapeutic disclosure is a must. Now how do we told so many things now, all these things. Now how do we keep a document of that? And how do we do that? I've answered that. Always make sure that document. Without a documentation, whatever you have told him, it is as good as not doing it. Burden of proof. Now always remember that in a case of a consent, normally the court presumes that the doctor has done the correct duty. It is for the patient to prove that there was a failure in the consent. So it is the patient who has to prove that the consent is not taken or not. Okay. So coming to another legal provisions, these are, I don't think that this is much relevant to this section, but I'm just highlighting that what I'm stressing here is that when a patient comes in various cases, like in a case when he was an accused or when he is an examination of a rape victim or so, these are the sections which deals with how to examine, and there is a provision. So you cannot simply say that I don't want to be examined or I can't examine these patients. There is a legal provision and then there's a method how to examine. Okay, I'll just simply go through that. It is not relevant to this particular audience. Always remember that silence means not other things. It doesn't mean that, oh, the patient has given a consent. It may mean that he might not have given a consent. So I said initially there were duties of the patient, duties to the professional colleague I have not discussed because it comes by the interpersonal relationship and the communication skills. So I am not here to teach all those things right now because I know that all of you know or will do a good intercommunication relation or interpersonal relationship with your colleagues. But there are certain duties towards the state. What are those? Consent, confidentiality, maintaining of the records, collection. In case the person is having come with some medical legal case, it is a bounden duty of a doctor to preserve. Make sure that what the hospital authority or the nursing superintendents can make sure that these are the must. So make sure that these things have to be done, like collection and preservation. And also, in the case of a dying patient, you have to make sure that dying declaration is taken. Otherwise, simply by not documenting, not doing that thing, poor doctors, poor nursing authorities, and poor hospital have gone into the so-called litigation. Make sure that this is done. Now, as one of my sir was, or in fact, sir was asking about particular case, what is the medical legal case? And then I said that I'll just touch about that. So normally when a case comes to the hospital, they put a seal called MLC, medical legal. That's so fine. What is MLC? Actually speaking, there is no definition per se of a medical legal case.